Senator, I want to ask you about the national debt. It's related to health care. The Comptroller General says it's headed through the roof. What specific steps would you take to curb the national debt?
The reason why we have the national debt at the level we have is because of spending. And also the dramatic expansion of entitlement programs without paying for them. Now, I'm a guy that voted against the Medicare prescription drug bill. Why? Because it was $800 to $1 trillion of unfunded liability that our kids are going to have to pay for. And by the way, you know what? You're paying for my drugs. Do you know that? Don't you think I've voted enough pay raises for myself that I can pay for my own? I mean, it's every time we have an entitlement program, even if it's worthy, we expand it and we're not going to pay for it. On the S-chip, I know what public opinion is about the S-chip. Do you know how we're supposed to be paying for the S-chip program, the additional $35 billion that they want? Probably a lot of Americans don't know. $1 increase in the tax on a pack of cigarettes. Now, so we're going to take care of children's health, but we're encouraging everybody to smoke? I mean, 22 million new smokers we need to pay for this program?
You described the problem with Medicare as an entitlement that's growing. But what do you do now? I mean, it's growing. You're going to raise some taxes. You're going to cut the benefit. How do you deal with that?
With competition in these areas and to make sure that we can implement these reforms, it will bring down costs, and part of that it will be competition, whether it be for insurance companies competing for different categories of people, whether it be pharmaceutical companies competing, whether it be really one of the important aspects of this is to put more responsibility on the person who is insured. Right now, as you know, when it's paid for and taken care of, then people are not as responsible as they will be. And part of that is a higher copay, but it's also more of an investment on the part of the person who is the recipient. And one other thing, there's low-income people right now who cannot afford health insurance. I'm forgiving each individual $2,500, family $5,000 in tax credits. Now then they can go out and purchase the health insurance of their choice. And that, I think, is important. Then they'll be very careful how they invest that $2,500 or $5,000.
Quick question on energy.